for today's event. We are from Yango Children's Environmental Health Network, Alliance of Nurses for a Healthy Environment, the Global Climate Health Alliance, and even the International Pharmaceutical Students Federation and Indian Youth Society. Today we're bringing to you the Healthy Response to Climate Change, Community and Health Partnerships for Climate Equity. Just going to quickly introduce all of us. I'm Dr. Harshita Umesh, a board member of the Yango Health Working Group. We have our panelists, Nsedu from the Children's Environmental Health Network, Dorian from the Alliance of Nurses for a Healthy Environment. We also have Courtney Howard, who will be joining us shortly from the Global Climate and Health Alliance. We have Ms. Audrey Wong from the International Pharmaceutical Students Federation, and Neha. Before I begin, I would like to give you a small background as to why we're having this particular topic here today. The climate crisis is a public health crisis. In 2009, we saw that the Lancet labeled climate change as the biggest global health threat of the 21st century, but it's taken us so long to actually acknowledge that health has importance in the climate change sector, with this year's COP being called as the Health COP and us having an inaugural Health Day today. And while it's the biggest threat facing humanity and nobody is saved, it's disproportionately felt at low and middle income countries in the global south and even the most vulnerable and disadvantaged. And that's why we had Dr. Ted Ross this time say that undoubtedly health stands as the most compelling reason for taking climate action. And for too long, the climate health has been a footnote in these discussions. But something has been done. It's not that we're like completely hopeless and we're just standing here saying that nothing's been done. There has been some precedent to this. At the World Health Assembly in Geneva, Switzerland in May 2023 this year, resolutions were passed to strengthen the global architecture for health emergency preparedness, response, and resilience. As we all know, disasters are not natural. In August, under the G20 presidency of India, we agreed to build sustainable and low-carbon health systems. Health systems are one of the biggest carbon emitters of the world today. We also want to do this while ensuring that the quality of care is still maintained and delivered, and decarbonize the supply chains. This year, at COP, when the Health Day happened on December 3rd, we had commitments to raise the profile of health impacts of climate change and to mobilize finances for effective action so countries can prepare and respond. This is included in the Loss and Damage Fund. And the way forward is the way towards health equity and universal health coverage. So what is health disparity and what is health equity? Health disparities arise from preventable differences from the social determinants of health, and the burden of this is placed on the socially disadvantaged people, such as the LGBTQ, the indigenous, other minority groups. But health equity is defined as a state in which everyone has a fair and just opportunity to attain their highest level of health. And achieving this means that nobody's disadvantaged because of their social position. So, in short, health equity is basically what everybody has to lead healthy lives. With that being said, what is our way forward? Our way forward, our way that we're saying that a healthy response to climate change is we're advocating for partnerships. We don't want just healthcare professionals, we want other people to be involved in this. And hence we have our panel today that's composed of pharmaceutical students, the youth who are individual climate advocates, we have doctors, we have nurses, and we hope that this panel will give you a brief idea on what we can do to actually partner for health equity. With that, I would like to introduce our, I would like to introduce our first speaker. We have Ms. Nsedu from the Children's Environmental and Health Network.
Hi, everyone. It's nice to see you. I hope you are winding down your COP well and healthy. And I know, we all understand a lot of work has to happen after, of course. So the Children's Environmental Health Network is a national nonprofit. We've been working for over 3 decades with the same mission to protect all children from environmental hazards, and that includes the growing threats of the climate change. How do I advance? Thank you. So hopefully in this room we understand it's non-negotiable that globally 1 in 4 children, deaths among children younger than 5 around the world are associated with polluted environments. Those are only exacerbated further by the growing climate crisis. So we say often there may be no greater growing threat facing the world's children than that of climate change. It doesn't take away the range of environmental injustice that their families, in particular their moms' reproductive health rights are facing, but the reality is there. Children and women are bearing the brunt of climate change. So some of the ways that we are working in this intersection between children, justice, and climate change, which we do not see happening as much as it needs to be. We are a founding partner in the Climate Equity Collaborative that is working in that nexus. This is a public-private partnership. We're not asking the federal government or our states who are already strapped for money for this. We're trying to go to industry, tech, and other sustainable moving forward types of programs who have the investment earnings to come back and to capitalize and to invest in children. Also, we're trying to focus in on historically black colleges and other institutions that are specifically working towards equity and justice in the United States and beyond, and there's some other programs that I will mention. We're also trying to advance work that's already happening, so it doesn't mean that there aren't programs that could come up that are new. There are wonderful existing productive programs that need more leverage, they need more attention, they need more capacity. So we're elevating children's environmental health in this broader context of global climate change. We're building these on-ramps for these localized regional programs that need more leverage, more support, more money. We're providing more engagement, right? We're always stronger together rather than working in these silos, and we still see that even in the field of children's environmental health. We're driving investment, right? So it's one thing to have these lofty ideas, it's another thing to have a whole system for how to continuously to bring in growing capacity that's needed to fund the work. And we're elevating the overall information experience, daily experience, and funding and data that's there that continues to show us that we have to not forget our children and the growing threats to current and future generations. Also, our program called the Eco-Healthy Child Care Program is part of this nexus of the Climate Equity Collaborative. It's the only program working, at least in the United States, to train and educate child care professionals on low to no cost steps they can take to inform their environment, and most of these small businesses are owned by women, mostly women of color who are just kind of getting by economically as well. And we are working to bring them all kinds of information on reducing their toxin exposure as workers, but also the children they're serving, as well as energy efficiency and justice considerations, and what happens during a flooding in a major weather event, and how are they getting ready and adapting as well as being resilient for climate. Also, we have Break the Cycle of Climate Change. This is modeled after the Break the Cycle of Health Disparities program that's been running for about 17 years. It's well evidenced. It's a mentorship program where you take students in this case, historically black colleges, tribal colleges, Hispanic serving institutions, and giving them an opportunity to engage around specific projects that community groups have elevated around children's environmental health and climate change. And that not only are they getting mentored, but also they get a culminating peer-reviewed publication together. They're coming together and networking and all kinds of valuable information for the field, as well as their professional growth and development. And finally, we are growing a global children's environmental health network. I welcome all of you in any of these programs, especially this one. There is no international stage right now. At one point, the World Health Organization was trying to keep something going that hasn't been consistent. There's been lots of calls for us to do this, so we are very much lifting at least a communication platform for starters. No matter where we go in the country, in the world, all of us need to educate, raise awareness, influence influencers, raise funding, and find ways to make action happen. Our political systems are very different, there's no doubt about that, but there's a lot more that we gain to benefit by working together. So we have a children's environmental health movement. We encourage and invite you all to join it, and I look forward to our conversation today. Thank you.
Thank you so much for that. I really love the last statement where you said no matter where we go in the world, we do need to educate and raise awareness and raise funds. Going to Doriam, who will be speaking to us about the Latin America, but just before that, a short introduction about her. Doriam is from the Alliance of Healthy Nurses for the Environment. She is a nurse, doctor in nursing, with training as a master in quality management, safety and environment, and a specialist in quality management and health audit. She is an associate researcher at Miniciencias, with experience in research in bioethics and the environment and environmental health promotion. She is currently Dean of Faculty of Nursing at the Universidad Cooperativa de Colombia Campus, Santa Marta, and a member of ANHE, Sigma Theta Tau, and Sigma Xi. So she's going to be talking to us about what they're doing with special focus on the Latin Americas. Thank you, Dorian.
Thank you so much. Can you hear me? It's a pleasure to be here. Gracias por estar acá con nosotros. And I hope that you can understand my English, Spanglish actually. Well, they are Erica, Pilar, and Lisette. And we work with another nurses from ANI promoting healthy environments in Latin America along with the support of the academy. Nursing professionals have an important role in promoting healthy environments and preventing environmental risk factors that affect people's health and the survival of species within a framework of respect for nature and the fight for environmental and climate justice. Academic training in nursing revolves around polluting factors and social determinants, making it necessary to analyze the relationship with health, the environment, and climate change, as well as the interaction of human beings with the environment and nursing actions that promote healthy environments and improve the health of individual patients. At ANI Latin America, we believe that education is the main tool to change the world, and that is why we are promoting the inclusion of the climate change nexus in health in the curricula. We promote research, and we collaborate in training spaces. This year, we created a virtual academic exchange called Nursing and Healthy Environments, which discusses healthy environments as a protective factor for health. We had 170 students and 107 nursing professionals participate, linked to 5 hospitals in Chile, 39 in universities in Argentina, Brazil, Chile, Colombia, Costa Rica, Ecuador, United States, El Salvador, Mexico, Paraguay, Peru, and the Dominican Republic. Our alliance proposed to address multi-species, social, racial, economic, environmental, and justice issues in the face of the climate crisis, but entering the experience and knowledge of vulnerable communities and safeguarding the rights of nature to achieve planetary health. This implies that as health professionals, we must work for marginalized and excluded communities, which are the greatest risk of suffering the impacts of climate change due to their social identities such as race, class, including economic situation, gender, identity, sexual orientation, geographic location, occupation, religion, immigration, status, age, and ability. In this regard, we can reflect, although we cannot control the future, we can influence it through our decisions that possibly impact the environment, the surroundings, and the world that we are leaving to new generations. We invite you to take care of the environments and the health of people who most need it. This is a picture of the mountains of Colombia. There live 4 indigenous communities, and they need that we care the environment because that communities depends of that. Thank you.
Thank you, Dorian, so much for sharing that. I think while it's important that we understand that climate change is a very global thing, the regional impacts that we have and the regional actions that we're doing to accelerate climate action is also very important. And to preserve our indigenous knowledge, to preserve our indigenous heritage and our culture, I think is also very important that is being lost in these days. I'm not sure how many people are aware, but while doctors do treat patients, it is the nurses that actually run the entire hospital. And I think they're one of the best communicators with people. And it's really nice that we're working together to achieve planetary health. With that being said, another person without whom the hospitals would not really run would be our pharmacists. So with that, I would pass on the mic to Dr. Audrey Wong from the International Pharmaceutical Federation. She's based in the US and she advocates for climate change and a health for a sustainable future. As the chairperson of public health of the IPSF in 2022 to 2023, she led the delegation to COP27, where she co-led 4 side events. Understanding the importance of turning global mindsets to local actions, Audrey was also part of the Next Generation Climate and Health Ambassador Program with the Physicians for Social Responsibility, in which she attended the climate change and health-related capacity-building sessions and submitted letters on climate change and health to organizations. Outside the sphere of climate change and health, she also explored advocacy for food system transformation and is currently serving as the Youth Policy Board of the World Food Forum, in which she acts as the North America regional focal point and conducted regional consultations through survey and virtual consultation sessions. As a youth speaker at the 43rd session of the FAO conference and the high-level political forum, Audrey aspires to become the voice of the youth and young healthcare professionals and their meaningful engagement in the food system transformation. Over to you, Audrey, to explore how pharmacists are driving the change for climate action and for planetary health.
Absolutely. Thank you so much for this opportunity to share a little bit more. And then I have to say that this partnership with all of the health professionals is very important. But today I'm going to bring in a little bit more about pharmacy. So last year when I went to COP, I got a lot of questions about, so what exactly are you doing here? For a lot of people, you might think that pharmacists only dispense medications. Maybe some will even say, do you count pills? Yes, actually, the pharmacy technicians count the pills, but we do a lot of other background jobs, such as like dealing with the insurance and to make sure that there are no drug-drug interactions, drug-food interactions. And now with the indigenous community, it's also important to know about the drug with the herbal medications and the interactions. What I really want to go more into is that, what about, since pharmacists have a lot of different career paths, you can go into clinical, but of course another big thing that you might know is actually the industry. And so how is the industry doing? The industry-wise, actually the industry is also looking more into this climate impact. And they are actually looking more into the Paris 2030 climate goals. While they're looking at it, we know that only 4% are actually only going to be on track, which means there's so much more they need to do. If you want to know more about what is going on, is that the industry produce about 48.6 tons of carbon dioxide equivalent for every 1 million that they made. And with the automotive, which is like a car industry, it's actually only about 31 tons. That means that the industry is actually way worse than what we're thinking. And even if you go into the more clinical side, is that you look at your inhaler, what the inhaler that you're using is also going to cause carbon dioxide. So just like your metered-dose inhaler is actually one of those, is going to be about 170 miles, driving 100. So that's actually a lot. That makes us think a little bit more about, so what's going on with this pharmacy field and what can we do? And as I mentioned, that pharmacists, we have different roles. You can work in academic, you can work with the industry, you can work with more clinical path with the hospital. So this is why there's so much that we can do. But some examples that we have here is that one thing is that we can talk about the waste, about like how you're going to dispose your medications to make sure that you're not going to pollute the environment. Of course, some will just say, I don't know, I just throw in the trash or just flush in the toilet or whatever. This is why it's very important to actually educate them. But the whole thing as well, it's about the inventories and then the transfer process to make sure that when you order the medications, you're not just ordering a lot, knowing that you're going to dispose a lot of expired medications. Another thing is more with collaborating with the suppliers to look more into this active pharmaceutical ingredients to make sure that you also can set meaningful threshold for reduction. And if we go more into the adaptation, what we can also see is that we play a big role in looking more into this disaster preparedness. Since imagine that we have a flood today and then patients still need medications. So what do we do in the pharmacy? Is that pharmacist in the community pharmacy is already working with a plan about what we're going to do with the supplies if there is an extreme weather. So we continue to do that. And of course, it's important to have a resilient supply chain moving forward to make sure that we always have the supply that we need, but of course, not more than what we need. Another big thing other than all those that I've mentioned, of course, going to go back to this industry, because this industry is for sure causing a lot of carbon dioxide, is that the industry actually knows that it is causing a lot of carbon dioxide, and they are taking actions. It can be using more sustainable raw materials, or actually trying to use more renewable energy when they produce medications. Some examples would be that for Pfizer, so maybe a lot know Pfizer, they are actually also looking more into the greenhouse gas emissions, and their goal is to reduce it by 95% by 2040. But not only that, they also want to influence the other companies, because then maybe the question is, how do you know that they have incentive? Just one is not enough. They are actually influencing approximately 120 suppliers to also establish robust environmental sustainability programs. So another example, other than Pfizer, we can also look at J&J, which we might know because of the COVID vaccine. They are also looking into how can they reach the net zero emissions, and their goal is to reach that by 2045. So we see that the industries are really looking more into that, and together we are really looking about the fossil fuel phase out, changing into that energy that we're using to reach that net zero. And back to what pharmacy students can do, because we might be a little bit far from the industry, there's still a lot that we can do. Continue to prepare the workforce is that we, as an organization, IPSF focus a lot on public health, and one thing is on climate change. So continuously, we prepare our students. We have different webinars on more greener pharmacy professions, on safety drug disposal, but we know that it's not enough with just campaigns. So we are also working on position paper as well as different policy writing. So definitely very excited to continue to collaborate with different health professionals and see how we can have this greener healthcare system, but also greener planet for everyone.
Thank you so much, Audrey, for that. I think the thing I resonated with the most was, what are you doing here? I think as health advocates, for the longest time, we've been asked that question, why exactly is health over here? But also to know that during COVID-19, I think everybody, when they had the vaccine rush, we also did breathe in a lot of greener and cleaner air. I mean, I was really glad that I could experience that. So realizing how exactly the supply chain plays into this and how we can ensure that it's more resilient and well-stocked even with disasters on the rise is something really interesting. But I think with coming to that, we'd like to know from on ground what exactly it is and how it is difficult and not as easy to educate the people who work on ground like sanitation workers. And for that, we have Neha from the Indian Youth for Society. Neha is a social development professional and currently a strategist for the Indian Youth for Society, and she profoundly impacts waste management. Previously, they've contributed to India's think tank, Niti Aayog, where she spearheaded community-centric programs in her district in education and health, mainly focusing on adolescents' girls' well-being at the intersection of school education. Her interest in waste issues blossomed during her engagement with indigenous tribes in the Eastern Ghats, propelling her into the world of plastics and waste solutions. In her role at the Indian Youth for Society, she has mobilized over 5,000 school children and more than 500 sanitation workers through impactful capacity building issues. Currently advocating for waste workers, Neha aspires to be their voice, championing positive change for improved health conditions for waste workers and sanitation workers, and paving a path of dignity of work for them in India. Neha, over to you to shed more light on this wonderful initiative of yours. Sure.
I think towards the end of week 1 of COP28, we have seen participation of more than 100,000 people just from the blue zone and over 400,000 visitors from the green zone. As we are talking, as we are walking, we are producing trash. You know you are responsibly disposing out, putting in the right bin. We have thousands of bins placed in the campus, and yes, you're doing it right. But have you ever wondered, where does it end up? Who does it handle? So yes, happy afternoon everyone. This is Neha from Indian Youth for Society. And today I would like to plant a perspective, a context from India where health equity is compromised when it comes to sanitation workers and waste workers. Our organization works in the space of environmental education and plastic waste management, both in urban and rural areas. When we got ourselves into the world of plastics and waste management, it really hit us hard how the organizational informal sector is functioning, who is ever compromising. And what we do? We make people believe that trash is not just trash, but trash is a resource. I would like to spend some time to give a perspective on why we have to talk it here, why we have to talk on this platform. Because I'm referring to the scrap dealers here, I'm referring to the aggregators who usually rely upon these waste workers. Waste workers are on the bottom of their pyramid. And they are masters of the trade, of course. They collect, they segregate the recyclables. They are very much skilled. But just for a mere survival, they put their health at risk. Did you know that an average waste worker's age ranges from 34 years to 36 years in the Indian subcontinent? And there are so many health disparities, right, from the skin diseases, then mental health issues, and many other on-ground infections that they deal with at the landfills. And there is other side of bright picture that sanitation workers throw light on. We have sanitation workers all around, but they directly and indirectly contribute to affect climate change, because they are the aggregators who collect a lot of trash at once, and that leads to a lot of methane gas release into the air, lot of carbon footprint, a lot of carbon emissions. And that particular picture, the two women, they are Ramulamma and Varalakshmi. They are from one of the biggest organizations. They are working as sanitary staff. I don't want to mention the organization because it is very well known. But then they are responsible for segregating the waste of 4,000 households in a day. Unlike other countries, India doesn't have the norm of recyclables, non-recyclables, compostables. It doesn't have like that. It has dry waste, wet waste, domestic hazardous waste. And then these ladies take the struggle every day to open up every garbage bag from each of the 2,000 to 4,000 households. And that includes sanitary napkins, diapers, wet waste, dry waste. I myself personally witnessed that. And then there is and they barely earn $180 a month. And then there is this other lady, which is Shobha and her husband. They earn a lot. They are in the similar kind of business. They are also picking up trash. What they do is they have a network of collaborators of waste workers. And they come together and advocate for change where they collect thousands of plastic bottles in the city. And what's the difference? One is working for others, one is working on their own. But that's not it. These sanitation, in India, the average wage of of a waste picker is just 50 cents per week. And if it's a woman, it's 40 cents per week. And again, there are some roadblocks to their upliftment. Back in 1988, the Supreme Court and the Power Committee advocated that the waste pickers have to be integrated into the system. And still, even in 1995, there was another committee who has advocated that they have to be integrated into the system of urban local bodies. But still, it is not happening. And rag pickers or the waste workers are not included in the disaster management plan. And also, there was a recent, the last survey by UNDP India, where they have surveyed 14 cities in the state of Uttarakhand, where they have found that more than 50% of the waste workers are not educated, they are not formalized into the sector. And they are not even connected to any of the government schemes. Yes, they do have an Aadhaar card, which is the identity card of India, but they do not receive income, they don't file taxes, and they are automatically disconnected from the government welfare schemes. So we at India Youth for Society work on a prolonged comprehensive approach where we work on waste solutions, where we aim at minimizing greenhouse gases. One being we capacitate the sanitation workers where we onboard communities. We onboarded more than 110 communities as of now where we capacitate sanitation workers on how to segregate, why to segregate, and make them understand the relevance of segregation at source. And also we are currently working on the innovation and technology part where the waste can be tracked, the analysis can be made, and the worker safety is of course very important, where we facilitate the protection for the waste workers and also the sanitation workers. And there is the community engagements where we engaged in candid discussions with the communities where they come, they talk about waste and observe waste, and this is where even the youth are very much involved in the initiatives. And we work with the local urban body where we advocate for changes. Waste workers are one such of minority group where their voices aren't heard. Even they are not in the, they are actually called as the eco warriors who contribute directly to the solid waste management plan in the country, but they are not part of legislation. And whatever we do, that can be measured, that can be reported, but that can only happen when these waste pickers or these sanitation workers are brought into a limelight, and they can only live a dignified life when they feel that, yes, this is our job. And yes, there are so many landfills in India where people candidly just comment that if the people don't segregate their waste, we don't have a living. That is what they say. And yes, we always strive for better alternatives for them. And that's where I stop, where we give a voice for the voiceless, the waste pickers of India. Thank you.
Thank you so much, Neha, for that insight onto the lives of the waste workers and sanitation workers in India. It does seem really bleak, and it just gets me back to wondering about how my mom keeps telling me to keep my room clean and how much our parents really ask us to keep our household clean. So just imagine making sure that 4,000 households per day are clean, and not only just clean, but segregated. So is it really living if they don't really get a chance to live? I think that's really important. But coming on to the part of them not being a part of the system and not being a part of the legislation, I wonder what would happen if we did have a systemic change. And for that, I will be passing over the mic to Dr. Courtney Howard. Dr. Courtney is an emergency physician in Yellowknife in Canada's subarctic and a clinical associate professor in the Cummings School of Medicine at the University of Calgary. She's a nationally and globally recognized expert on the impacts of climate change on health and in the broader field of planetary health. She was the first author on the 2017-2019 Lancet Countdown on Health and Climate Change briefings for Canadian policymakers, as well as the 2018 International Policy Director for the Lancet Countdown on Health and Climate Change. Recently, she has been the Climate Policy Coordinator for CODA, a global group of acute care professionals convened by the founders of Social Media and Critical Care. As the first female board president of the Canadian Association of Physicians for the Environment, she has been involved in policy and advocacy-related work on active transport, plant-rich diets, integrating health impact assessments into environmental assessments, fossil fuel divestment, carbon pricing, coal phase-out, and the health impacts of hydraulic fracturing. Dr. Howard is on the steering committee of Planetary Health Alliance and the editorial advisory of the Lancet Planetary Health. Dr. Howard, I look forward to listening to you explain to us what exactly planetary health is and how it can be used to leverage for health equity.
Thanks so much, and what a joy to be on this multidisciplinary panel of people from all around the world. And can we give a hand to the color coordination here? Like, check it out. That was happenstance, wasn't it?
Yeah.
This, like, look at this synergy. We're reading one another's minds and working as a team already. So, it's really such a pleasure because we usually, I grew up in medicine and have spent a lot of time with physicians, and we're often missing parts of the team in these types of conversations. So we're missing either the nurses, or we're missing a pharmacist, we're missing the community linkages. Having people representing sanitation workers, that is incredibly important. And so I just, I'm very excited to be here with youth representatives as well. It's just a pleasure. So I started working on this in 2009. I was a new physician. I went to the subarctic because I wanted to work for Doctors Without Borders, and in fact, all the way up to the Arctic, where it's already 3 degrees Celsius warmer than when an 80-year-old elder was born. And that's where I read that in the Lancet that they said that climate change is the biggest health threat of the 21st century. So I had just given up my 20s to learning how to treat health emergencies, and I was like, pardon? How did we miss the biggest health emergency? And I was very angry that it wasn't in curricula. And so I essentially went from there down to the Family Medicine Forum. I started talking to all of the different leaders in family medicine in Canada, and I genuinely thought that the minute I showed up and said, did you know that climate change is the biggest health threat of the 21st century? They would say, really? Oh, the Lancet, a trusted source of information for me, says that. I will now immediately insert that into curricula, and we will just move on together and treat this health emergency properly. That was in 2009, and it's still not in most health curricula in Canada. And so what we've realized is that, in fact, we need to learn how to be advocates in order to get this into curricula. And so I've tried all sorts of different ways of doing this. I have shown up at all sorts of meetings, Canadian Medical Association meetings, college meetings. I've written proposals. I have written editorials. I have just laid in wait for people outside of the bathroom. Been like, you're the boss. Or waited until they got off the stage, And there was a time when people would duck away when they saw me coming. And so it's taken a while to get to the point where we've made a move that worked, and so I really wanted to let people know what's actually worked. So we did finally manage to get this into some keynotes at big conferences, and that has been a really big deal, because what was continuously happening was it was usually often women. Actually, there are surveys showing that it was young women learners who were really concerned taking these issues to deans, to people in leadership in medicine. Those people are still disproportionately men. Most of the time, they didn't know what they didn't know about the health emergency of climate change. So because they'd never read about it, they didn't see it as part of their work, and so they weren't motivated to get it into curricula. And in fact, they didn't really realize the risk. They didn't know how bad it was. They didn't know we were already facing heat domes, that we were already facing wildfire emergencies. My own hospital was actually just evacuated this summer. We had to evacuate a 100-bed hospital 1,000 kilometers away due to severe wildfires. So until a couple of years ago, the impacts weren't that clear. And so they just tended to sort of brush these concerns away. So once we finally, just in the last couple of years, started getting this into the keynote spot in large national conferences, all of a sudden we're taking our leaders from that place where they don't know what they don't know to a place where they've been a little bit briefed enough to get scared. And that made a really big difference. So any type of advocacy you can do to get it into those big spots in the big rooms, that is actually really, really worthwhile. And so one of those times, what happened was that I presented with the leader of the Royal College of Physicians and Surgeons of Canada, And it was seen by the woman who ran the Association of Faculties of Medicine of Canada, which is a constellation, an organizing body that organizes the different curricular centers and the different medical schools. And she became a champion. So she became the champion that we needed. She led the development of this Academic Health Institutions Declaration on Planetary Health, gathered a global group. It was multidisciplinary. We had a representative from the International Federation of Medical Students Associations, nursing, et cetera. And we came up with just a short briefing document, this is the problem, and then a list of commitments that included moving planetary health into curricula, working towards sustainable, resilient, low-carbon health systems, divesting from fossil fuels, or trying to get your institution to divest from fossil fuels, as well as committing to support the call for a fossil fuel non-proliferation treaty, because we know that phasing out fossil fuels is really the #1 treatment for the health emergency of climate change. And so because it came from the deans, she then sent that to all of her dean friends. And because it was a peer asking them to do this, they actually signed on. And there was a bit of a timeline associated with it. They tried to get it all done before a big international conference on medical education that they were holding in Canada. And so they did. We got all of the medical schools except for one in Canada signed up. So no, we're all having meetings. Nobody really knows what they're doing at the meetings, but they're coming to the meetings. And now that means that we actually have a start, and Health Canada has actually just committed to funding this so that we can start to implement the declaration. So in the last couple of weeks, at the request of colleagues from the international community, someone named Dr. Jamila Mahmood, who runs the Sunway Center for Planetary Health in Malaysia, she said, what you guys did actually worked. Can you please bring this into the international space? So we published a commentary in The Lancet just a couple of weeks ago called Seeding a Planetary Health Education Revolution, because we really believe an education revolution is what's required. And this was strategic, again, thinking about advocacy. The Lancet is really one of the most trusted sources of information for the leaders that we're trying to influence. So we made the pitch to the editor to say, hey, like, we're still having this problem where we're having these high-level discussions at COP. Our countries have all committed to all of these programs for sustainable low-carbon healthcare. And when I go home, I know my colleagues have never been briefed. This isn't going to work unless our entire sector gets briefed. So this has gone out. We're going to follow up on it at the upcoming Planetary Health Conference in Malaysia, and again at the next Society conference for the International Medical Education Body. So if you're still working on trying to get your institution on board, I would really encourage you to bring this to them, because the thing is, they have to say yes or no. It's a decision-forcing event. And so even if they say no, they still had to read the thing. And they still had to offer you an explanation as to why they said no. And what you'll find is that that no starts to plant a seed. And then if you show up again a month later, or you send a friend in, so it's a different face, it might turn into a maybe. And pretty soon, I think you'll get to a yes if you persist. So I think that in this conversation, we're seeding a planetary health revolution that is multidisciplinary, that is global, and I just really, really look forward to the rest of the conversation. Thank you.
Thank you so much, Dr. Howard. Hopefully nobody here in this room runs away when they see you in Malaysia when you attend the Planetary Health Conference. But one of the things I wanted to highlight about this very diverse panel is this has been a very intergenerational dialogue. Very often we're passing the blame on from one generation to the other generation, saying that, oh no, you do this more, or why is this the only thing you're doing? But to have so many speakers here, especially from the indigenous, from the youth, and this is a panel composed of women. Like, I mean, kudos, like we're all the people who've been facing the effects of climate change and the vulnerabilities of climate change. And to have a multidisciplinary panel speak about this, I think we've really hit it off. So kudos to us for actually pulling this off. But before I open the floor to questions, I have a couple of questions that I'd like to ask all of our speakers here. I was just wondering, from your lived experiences, if you could answer what has worked the best so far in terms of the work that we have done to influence climate justice or planetary health education? Would someone like to answer that?
I can jump.
Okay.
Oh, please.
Okay. Dorian first, and then Nsedu.
Well, I have to say that In Latin America, the nurses start to talk about this subject a few years ago. At first, when I said, I'm working about climate change, everybody said, what? You're a nurse. You must work in chronic health as ISU, but not climate change. Right now, we make a climate justice agenda for Latin America. We are talking about that in important nursing events. That's really important because before, nobody wants to hear about that. And we made recommendations for the curricula, and right now the universities are calling us to talk with them and to give recommendations to them. So I believe we are doing the change, and we are, at the first, we were 15 nurses at the ANI in Latin America, and right now we are more than 400. So I believe they are listening to what we are doing. Thank you.
Nsedu, over to you.
Yeah, I remember, I mean, I'm not that old, y'all, but I do remember being in rooms, being public health person where the health side of this discussion wasn't even a thing. It was not being taken serious. So to be at a COP where the health declaration has over 100, and I've been keeping up, 20 plus countries, very positive. It should not have taken this long, but we will take, you know, these successes and these little benchmarks when we can. However, when you talk about vulnerable populations, when we're talking, the question was on justice specifically, we know the layers of injustice that are happening continuously as a result of exacerbated implications from climate change. And again, as I started, women and children in particular, and then if we break it down, women and children in the most impoverished countries and the most economically disinvested communities and communities of color and on, all the indicators are suffering the hardest. So, being that we do need women in particular to have future generations, among many other justice and equity platforms and principles, we are not there. We are not there. And again, the youth, I just want to give a huge shout out to our young professionals coming up the ranks behind us, teaching us a lot. We have to be engaged with our youth, right? They're showing us as the generations, the older generations, if you will, and there's a sense of urgency that we should have had 30, 40, 50 years, you know, ago, and here we are. So the fact that health is on the map, great. We are very much lagging when it comes to vulnerable populations, and no offense, but what are we now doing with this new informed, you know, being awakened, excuse me, of, you know, understanding that health is a big part of this scenario as well.
Thank you so much for that. Would anybody else like to answer this question? No? All right. I would like to ask, what do folks have to gain by including health sector in their change-making efforts? Neha, maybe you'd like to answer this? What do folks have to gain by including health sector in their change-making efforts?
I didn't get the first word.
What do folks, like people, have to gain?
Okay. One thing that really amazes me when working with the community is I'm talking about the community who are usually not very much exposed to the outer world. They think that health is something, an alienated word for them, because they are usually stuck with the taboos that they are surrounded with. With one of the experience I had is interacting with the tribal healers. What they mean to say is those are the recipes that have been coming down from generations, and they think that is the systematic change for them. They don't want anyone in their territory. But then when the health systems directly converge into their hamlets, they started to think, they started to understand why we are here, why are we doing this. It is as simple as a 12-year-old girl, the research study that I did, she doesn't even know how to use a menstrual pad, because that is the environment that they have been living in. And there is this one taboo in the region that I am staying in. They are not allowed to go to temples, they are not even allowed to touch anyone during their menstrual cycle. And then when it comes to men, at the same time, even if they're unwell, even if they're not, they're free. Again, it's not the community health alone, but again, a gender perspective that is coming into the picture. The gender equity, the health equity, and also the pregnant women here. The pregnant women in the region, they're not allowed to consume all the fruits and vegetables. They are just limited to lentils and some rice and some soup maybe. So, in this one very topic, there is this health equity coming into the picture, the gender equity coming into the picture, the food systems that is coming into the picture, and also the root of all education is coming. The very own discussion that we are having, the planetary health education, is the root cause of all of it.
Thank you. Audrey, would you like to add a couple of statements to this?
Yeah, wow, that is a very powerful statement. But I would say that why it's important to include the health sector. I would say that people who work in the health field, we really see people from birth to like death. We see the very vulnerable side of it. And this is why when we say that climate crisis is a health crisis, it is what it means because we actually see patients coming to us. And then they show us, tell us the symptoms, and then tell us what it's going through. And then we're on the spot thinking to see what we can do to help them. I think having the health perspective is that we cannot treat everyone with just ourselves. It is why it's important is that we work together to kind of understand more about what is the research behind, do we have any evidence, is there any more data that we can use to plan to have a better treatment plan. And when we see that there is a group of people within the community who might have have an increasing asthma rate, and we know, okay, yeah, then it is coming, that we know how to deal with it. So I think that having the health perspective is that we see a lot of cases, but then it's about how we work with the other professions and to have continuously have this healthcare in a more thorough perspective. Because it's not only about being sick, but it's, of course, the well-being too. And we started to talk a lot more about mental health, and it's that the younger generation, the children nowadays, they are just more and more worried at a younger age. And that's something that should really give us a red flag that we need to think about it.
Thank you, Audrey. Dr. Howard, would you?
Sure, yeah, this is a topic I love. So we know that across the globe, health professionals are amongst the most trusted professionals. And we know that people change their behavior when they trust the person who is asking them to make the change. And so what that means is that we have the ability to make a tremendous amount of transformation. I don't know if you've seen the graphs. It's usually a nurse at the top. Pharmacists, doctors are usually around the same, and politicians are way at the bottom. So when we think about who we've been trusting to try to save the world from a climate perspective, we've got our politicians up there. It's not the right team. Right? And meanwhile, there's a lot of us, particularly nurses, embedded into communities in these networks. And so the Global Climate and Health Alliance, we've led a couple of sign-on letters where we've had support calling for a healthy response to climate change from organizations representing 45 million healthcare professionals. That's a lot. So when you combine our trustedness with our numbers, with our global reach, with the fact that communicating climate change in a health frame has been shown to be one of the most persuasive ways to communicate it across audience segments, so across the political spectrum and across the globe, we can see that we have the potential to raise the overall ambition of the entire sector. We also, in the health sector, allocate about 10% of global world product. So we control a lot of money. So that means that if we work to switch our procurement policies to low carbon pharmaceuticals, what we're actually trying to do globally now that we have over 50 countries signed up to the WHO Sustainable Low Carbon Resilient Healthcare Systems Network, we're exerting a force field effect on the entire pharmaceutical sector to basically be like, look, we're not going to bring your stuff. We're not going to buy it anymore unless you decarbonize. And so when we work together in a coordinated way, I truly believe we actually have the ability to shift markets as well as to shift policy and to raise overall ambition. It's a tremendous possibility that we are part of. And seeing Health Day happen, ministers show up with commitments, all of a sudden, this only really started 2 years ago. So imagine where we're going.
Thank you so much. I really love how you say that we are a new hope. With that being said, I would also like to reiterate the definition that WHO uses for health. WHO doesn't define health as just good health and well-being. It's not merely the absence of the disease, but also a person who is feeling physically, emotionally, mentally well as well. And with us being some of the most trusted professionals, I'd like to shed a little light on what Youngo Health Working Group is doing over here. Youngo is the official children and youth constituency of the UNFCCC, and we have many thematic groups where we work at, and one of them is the Health Working Group. And this year, we co-hosted over 17 side events, just the youth with our partners, and it was amazing because last year we held only about 7. But this year we've also shifted from not just talking about it and making promises and words, but we've also shifted towards action with us conducting health camps in India, which was a pilot project which is slowly being made into a working model. This project was called Vada, which in Sanskrit translates to promise, and this was our promise towards universal health coverage and health equity. So what happened was the Yamuna floods, when they happened in Delhi, was very close to the G20 summit, the final summit that was going to happen. And there was a lot of work that was being done, and I'm really proud of our government and every other stakeholder that really pitched in. But what we did not see happen was health. We did not see the health of those people being taken care of. Like the immediate aspect of it was taken care of. And when disasters hit communities, most people don't die because of the disaster, but rather because of the health effects that follow the disaster. Most of the deaths are, unfortunately, due to acute diarrheal diseases, gastrointestinal diseases, dehydration, lack of nutrition, and common cough and cold, like influenza. Can you imagine just having a cough and cold today and being in an ICU tomorrow? It was really disheartening to see that, and we really thought that as youth, we want to change this. We need to do something about this. And what worked for us was not the fact that we were just youth, but we had a multidisciplinary team that worked with us. We had indigenous knowledge and indigenous medicine into the picture. We had nurses, we had dentists, we had physiotherapists, we had occupational therapists, and all this was compounded with the fact that we had experts in the field who went over our plan of action and run of show and said, all right, I think you guys have got this. Now the only thing to do is to actually try your hand at it and see what works and what doesn't. And I am glad to say that we have helped over 2,500 plus people that included children and women the most. And the fact that I say children and women the most was it was really difficult for us to actually bring them out of their homes, for them to actually access the very basic healthcare facilities. Most of them did not even have access to sanitary products. They didn't have access to pads. They didn't have access to pregnancy kits. And we had pregnant women who had just delivered babies who were coming to us, and we were like, what do we do? Why have we as society failed? Is there literally no hope for the future if this is what it's going to look like? Is it really this bleak? But when we spoke to them, we realized that the main issue was that they weren't aware. For them, climate change is something that's happening on ground. For them, this is the reality. They don't believe that there is a world outside of this. They don't believe that, they have a right to life. They have a right to a healthy environment. They have a right to health or food or anything else. And to actually educate them and capacity build them and give them a ray of hope, I think that's what we as healthcare professionals, we in the health sector strive for every single day in our lives. To tell them, yes, there is a better tomorrow. No, this is not life. And yes, we are there to help you every step of the way. So with that being said, I want to end this panel discussion with one last question. What gives you hope moving forward? Who would like to take it?
Again, it's our younger professionals coming in. It doesn't mean we just sit aside, right? We are obviously here. We've obviously sacrificed our schedules, our economics, whatever, to all physically be here for all the benefits I hope we're all continuing to get by the networking, the broadening our tents, the learning, elevating our thinking, all of these things, which I hope are happening here for the most of us anyway at COP. And it is making sure we are very attentive and aware that it is not us reaching over to our generations. It's rather us coming up together, learning, engaging. There's a lot of frustration, anxiety, anger, very justified, right? Why should these burdens be laid on our shoulders? Why can't we just have our teens and our 20s and think about building our families and our futures and our professional lives? But now we have the weight of the entire world on our shoulders, right? So there's a lot of skill set, there's a lot of creativity, there's a lot of musical talent and arts and talent, and all these things that we know help people in generating how we connect as human beings so that we actually listen to each other. And neighbors are another highly ranking group. Our neighbors, our fellow citizens on this ranking of who do we trust in this larger world. So I just want to give, again, another shout out for our youth, our younger professionals coming up the ranks, who I do believe are going to continue to harness a much different perspective and ensure that not only do we flip the paradigm of how we run our economic, educational infrastructures across the world, but ensure that we sustain it in a much more just way.
Yes, Dorian.
I want to tell you something that happened this morning. I was visiting the pavilions of the countries of this site, and I asked them, do you have something about health and climate change? All look at me, huh? Nothing. We don't have anything about health and climate change. I hope that the next year, if we go to the pavilions and ask the same questions, the country said we are working about health and climate change. I believe it's important that the governments include the health in the agenda. It's really important. Only one person of El Salvador said to me, we don't have anything, but take my car and ride me because I'm going to invite the health professionals to talk about that. Thank you.
The fact that a decade ago, no one knew what health and climate change was, no one knew the combination of climate and finance was, no one knew the combination of the intersection between maybe education or finance. So I think the very fact that we are taking a step forward in educating ourselves, learning from others, creating forums like these where people get a voice to speak out, I think that is hope for us to go ahead and explore it together, learn together, and grow together. Yes. Would you like to?
Yeah, I would definitely echo that. I think the hope is that there is this group of youth here that are very passionate about promoting climate change and health. And just like for the program that I've done with the Next Generation Climate and Health Program, seeing the cohort of people, starting from having webinars, capacity building trainings, and also have a group of people who actually approach the local government and talk to them about climate change and health and talk about the declaration about what they can do locally, that is very powerful. I think that it's so great to see that all these initiatives that we have, and then moving forward is that how we can approach even more governments and also have more concrete plans about what they can do with greenhouse emissions and then what they can actually have regulations with climate change and health.
Yeah, I think we really do need health in the negotiations and even in the nationally determined contributions. Dr. Howard?
I just wanted to say it wasn't that many years ago that there were about 5 of us here. Like really, it wasn't. And 2 years ago at COP26, we thought maybe 8 countries might sign up to the WHO Resilient Low Carbon Health Systems Program. And then the US signed up at the halfway point. And everybody was like, oh, maybe we should. And all of a sudden it was sign on, sign on, sign on. And we had over 50 by the end. And so what I've seen over and over is that you can have a race to the top just the same way you can have a race to the bottom. Inspiration is a positive feedback cycle. And so over the last couple of years, the incredible energy that's built around this, the fact that we have this many people here from the health sector, and we're doing good work. I went to the policy meeting right before coming. People are following that negotiations in detail. They're getting health language in there. They've got relationships with negotiators. We're really starting to bring it as a health sector. And the thing is that our people are smart. We're good at learning quickly. We're good at analyzing science, making a plan, and making relationships, that's not actually a very common skill set when you think about what scientists usually do, what politicians usually do. I think we can connect a lot of the dots that haven't been connected. And as long as we keep our focus on that compass of well-being and health, that's a unifying frame. And anything, so many things we do make our lives better right now. You know, we phase out coal-fired power, we reduce air pollution, we keep kids out of the emergency department with asthma. We get kids on bicycles instead of in cars. That reduces mortality. We empower women with education as well as access to the sexual and reproductive health care that they tell us that they want, reduces maternal mortality, reduces neonatal mortality, and reduces the overall carbon footprint of humanity, as well as increasing women's power within their families and their chances of running for parliament, which also, once you get more women in parliament, decisions change. We tend to invest in education, we tend to invest in health, we tend to invest in the environment. And so really, I think that we've sort of hit a critical mass of people who are interested and skilled in this area. And we have already changed the world for the better. We're going to continue to change the world for the better. And every single step is a step towards a healthy Tuesday for somebody and a healthy future for all of us. So thank you.
With that, we come to the end of our panel. We're opening the floor for questions. Does anybody have any questions for our panel? Yeah, all right. Yes. Yeah, yes, please.
So hi, I'm Prem, and I'm representing the youth association called EARS, the largest student association in the field of agriculture and related sciences. So I heard a lot about the climate and the health system, but I'm wondering that how you connecting the health system with food system policies and other things, because it's all about food and climate and health together. It's not the different parts. So how can you connect those things into the into the negotiation part and intervention, and how can you proceeding those things from the health sectors?
Would someone like to take this?
Well, thank you. I'll start. We definitely know that our agricultural system is a non-negotiable part of the solutions here. We all have to eat, we have to drink, we have to breathe in order to survive. Those are just realities. And we do know that regenerative soil techniques are going to be a part of our future for a variety of benefits, as well as the future generations. And in the US anyway, what's talked about a lot, and I think this goes worldwide, it's also a very helpful way to help people bring themselves out of poverty as well. But all those benefits aside, you're exactly right. I am not seeing as much of a connection as I think we need to have among our hospital systems that are working to transform our healthcare systems. I'm hearing more about our pharmaceutical systems. These are all very important. Unless others disagree, I think there's a lot more work that needs to happen, being intentional about those systems, which very much connect in working together. And think about the strength of what can happen when those huge systems are much more in partnership than working parallel.
I'll just jump in there. Yesterday was Food Day. Mm-hmm. And I didn't actually even know that until I was about to meet Gunhild Storlin. And I was super embarrassed. And so you're totally right. We haven't talked to one another, but we had a meeting after that, and we're going to. Because healthy food is one thing that we don't actually learn about in medical school. When I look at the plates, like what we actually feed patients, it's not really food. There's a lot of pseudo food on there. And so really the opportunity to use the purchasing power of healthcare to actually steward local sustainable agriculture, that's gonna have food security implications, help people appreciate where their food comes from, have cooking classes. There's actually hospitals that have cooking classes so that people learn how to cook with lentils. It might not have been something that people learned about in their family, but it's so healthy, so good for the people and the planet. So I think there's really a ton that we can do in the next couple of years.
I would just like to,
Can I?
yeah, right after. I would just like to say about the healthy food, in India, where I'm from at least, we have a lot of locally sourced food and a lot of locally sourced vegetables, which are more popular among our patients and the lower socioeconomic strata than it is with the higher socioeconomic strata. And we actually, when we are giving out food, we ensure that it's more of a balanced diet, that we do, and we have markets that are pretty close to the hospitals itself. So the food's actually very locally sourced instead of being transported so far. But also in India, like since our education rates aren't really up to the mark, we have something known as the midday meal scheme that actually we give for the students. So what we try to do there is we try to provide them with these lunches, which includes locally sourced vegetables, the vegetables of that particular month, because we're a very seasonal country. We also include lentils, we include rice, and we ensure that it has all the different colors. I'm not sure if anyone's heard of the color palette theory of food, where it's actually divided into 5 different colors and said that, you know, it's not just about having enough carbohydrates or proteins, but it's also about having enough of these colors in your food. So yeah, that's a part of our programs. But of course, I think it's very important for us to discuss this nexus and intersectionality and partnership further, because it would be something really powerful. And yes, ma'am, your question.
Thank you. Mine is more of a comment. I hope that's okay. I'm Dr. Mini Oseji from Nigeria. I'm wearing 2 caps. One, the permanent secretary of Delta State Ministry of Environment, and also the chair of the Special Interest Group on Violence Against Women and Girls for the Medical Women's International Association. And I've really enjoyed, this was almost like an accidental engagement, but I've enjoyed it, and I'm just wondering about scaling up. I do not know if there are strategies like what the presenter on the sanitation worker said was so fantastic. I work in environment, even though I'm a medical doctor, so I'm one of those people you ask, what are you doing here? And the issue now is the things you have done in your country, they're so beautiful, but how do we get it everywhere? So I do not know if there are networks for us to be able to scale up. The COP conferences are good, but outside the COP conferences, we've got to find ways to see that it's not just one country, India, or one country, US, doing the right thing, but 153 countries doing it. And I would love us to begin to look at that. I have one suggestion, though, and that is using professional associations like the Medical Women's International Association. We have about 90 countries. So if you work with them, you get 90 countries. Then the World Medical Association, you work with the Pharmacists Association. That's the international association. So I'm hearing about the pharmaceutical students for the first time, the Pharmacy Students Federation. So what we're saying is that there is also things like that, World Medical Students Association, World Nurses Association. So if we could use that, then we'll find out that many countries can come. But I would love to know if there are other ways in the past that you've done things to scale up the best practices. And then secondly, since we are talking so much about health, we have another session later today, Nigerian Delta State Ministry of Environment, Delta and the nurses across borders. We find out that this issue of discussing health and climate has not really done very well. And we've been saying that, we said that in Sharm el-Sheikh, we said it again. So can we look at the ministers of health, if we can work together and approach them, not just Tedros, World Health Organization, but all the ministers of health, and come with a concerted effort. And I'm really excited to be part of such a thing. I would like to take your card or receive my card, and let's see how we can do some action. Thank you.
Thank you so much for that very powerful intervention. Can we have a huge round of applause for her again, please? Do we have any other questions from the floor? Yes, please.
What have you experienced to be the biggest barriers to getting what you're trying to do done?
Okay.
I can start. Barrier number 1 is when people don't know what they don't know. That's a really frustrating one. For a long time, doctors, and a lot of doctors still just have this in a box that isn't the doctor box. And so they have no idea that climate change is a health emergency. It hasn't dropped yet. It's starting to become clearer and clearer with every wildfire and evacuation, et cetera. But that has been a really big barrier. The second barrier has been for a long time. I was, for instance, showing up at talking about trying to get medical associations mobilized. I'm on the Canadian Medical Association board. 12 years ago, I went to my first general counsel and presented my first motion as a young doc, and they didn't want to hear from me. I was asking for increased peer-reviewed studies into the local health impacts of the oil sands in Canada, which disproportionately impact Indigenous peoples. And they didn't want to pass that motion. It was really emotional. And then I kept showing up with more motions with more data associated with them. By the end of it, I was the only person who was coming with a motion that actually had an appendix for references. And I was like, come on, you're my medical elders. You told me that we were an evidence-based profession. But what I hadn't realized was the emotional resonance of the information that I was giving them. I hadn't really realized that I was essentially asking them to cope with the diagnosis of climate change and what it meant for themselves, their families, and the rest of their lives as physicians. And so once I started to understand that every time I had an interaction, I had to speak to the head with data, acknowledge the mental health impacts and the emotional work required of all of us as we to process these emotions and offer something for their hands to do, like a ready action item, I started making a lot more progress. So now that's almost in my differential diagnosis of anything I do. Okay, how am I addressing the head? How am I, surfacing the feelings we all have around this, normalizing them, and helping support people through that? And what am I offering them to do? Yes.
We love clapping.
Yes, we like action. So I talk a lot about framing why is there even a need for an organization at an international level and domestic level focused on children. Hey, what about children? How will said policy impact children? What about the women who bear the children? It's the first environment. It gets exhausting, but what I would say is that childhood cancer rates are going up since the year I was born, 1975. We haven't missed 1 year. They're incrementally going up. That is not genetics. What I will tell you is that our neurological developmental delays in children have increased over 200% since we've been tracking. Childhood asthma, the #1 chronic illness, we have no handle on this. I can go on and on. I have slides for days. I could write dissertations on this stuff. Our biggest barrier in the field of children's environmental health is that we don't take children seriously. How many more things do they need to bear? How many more? And it's not just the child, it's the people who surround the child. It's the family. When one child is dealing with asthma and poor air quality that's exacerbated by climate episodes, the entire family unit, economically, mental health-wise, days off of work, days off of school. Help me understand how a child who's not homeschooled misses so many days and out of school and is somehow going to have a trajectory that's going to keep them connected to their school and their learning. I mean, that's just one of a few of these, right? So we have a lot of lip service. I'll just start with the US, a lot of lip service. But our educational system is struggling, our economic system is struggling. I mean, we could go on, and yet we say we profess that we are so protective of our children. So I'm just going to say what it is. If we really truly cared about what we're talking about here today, we would change, again, the whole paradigm shift of how we even address climate change in this case and build it so that it is surrounded by the needs of the most vulnerable. Children, our immunocompromised, our seniors, our women, we could go on and on. That is a system we have never seen in any world that we've lived in, that I've lived in. So I went there. That's the biggest one.
I would just like to echo the statement where she said that children are not taken seriously. I mean, we're youth and we're not taken seriously either, and I think that's one of the biggest barriers that we face. Like when we give out any kind of data, they're like, where did you get this data from? And even if we cite a source, they're like, are you sure? I'm like, hello, it's a source you're using too. It's not something that I'm cooking up from my mind or from a pocket somewhere. And even if we have that and a tangible plan in action, what next? They're saying, oh, maybe this is just a phase for you. Maybe you're going to get bored of this in some time. And I'm like, no, this is my life. This is my future we're talking about. This is our well-being that we're talking about. We're not going to get bored of this. This is something that we have to live for the rest of the day, for the rest of our lives, and we don't want to suffer. We want to do something about it. But even then, even if we do it on our own, where's the finance coming from it? Like, there is literally very few grants that are given, and even if grants are given, it's usually given to organizations because of accountability mechanisms that are in place. And yes, I'm all for accountability. I am all for transparency, but that leaves out a huge sector of population that are advocating on their own because they don't know who to collaborate with. And even if they are collaborating with people, there's a lot of whitewashing that happens. There's a lot of tokenism that happens. There's a lot of spaces where we're being left out because there are already traditional actors or more well-versed actors in place, and there's not much for new and upcoming generations to really speak out over there. So I think that's one of the biggest barriers that we face as youth, that we are youth and that we don't have access to finances.
Yes. I really want to echo on that part about the resources. I think that as youth, probably one of the biggest barriers is that you don't really know who you collaborate with, but when you try to reach out, you don't get responses. So then it's like, what do I do next? And it's not that we do not want to scale the actions, but a lot of times these people want to see what we can do before they will invest, which means we need that resources to start doing, if it is financially or other support. Another barriers that I have seen is that actually, the interconnectedness between different fields. Just like the question about like, oh, why don't we talk about health and food? Surprisingly, being on the Youth Policy Board Wilford Forum, I'm actually the only person who's from the health profession. So everyone is talking about the food. And they actually asked me, oh, so what are you doing with food? Yes, coming from the health background, I guess I have a lot to do with food. And we need a lot more conversation between all this and to really see what are we doing here and how we can work together. A lot of times I talk about the one health approach bringing into the food people and see they don't always understand or like they know a little bit. I think that it's more about the knowledge and then how we each can bring to the table and how we can work together. Yes.
Well, I have to say that now we need to see everything like an opportunity. We need to give education to the people. We need to work together, doctors, nurses, pharmacists, everybody. Actually, the research, it's important if we have a team with multidisciplinary professionals. We need engineers, we need everybody working with us because we have the same problem. We are suffering this problem. So we need to work together and we must to see this like an opportunity.
This will be our last question before we wrap up. Just a minute, please, because this is being live streamed and they won't be able to hear you.
My name is Loretta Slater, and I'm from the United States, South Carolina. I'm one of the mothers that lost a child, and I would like to get data on cancer, not only cancer, just environmental health, just like she was saying, we need to know, and I need to take that back to the communities to educate them, because they don't know.
Thank you for finding this as a safe space to share it with us, and we're really sorry for your loss.
We're definitely connected, so I'll make sure. Anything you have, you got. Anything I have, rather.
All right, so this will be the end for this panel and for our lovely interactive participants. But before I formally end this, I would like you all to take a minute and think about what you can take away from this particular session. I know you've heard a lot. I know I've learned a lot. But I want you to commit to something right now. I want you to take a pledge. I want you to take some time out and say, no, when I go back today, I'm going to do something about this. Either it's going to be education, whether it's about capacity building, whether it's about financing a youth-led initiative, whether it's about connecting with your neighbor, or it's about advocating for health as a movement for climate action. I want today for us to actually make this a revolutionary step to the future. I don't want this to just end within these closed four walls. I don't want this to be within closed rooms, because our voices need to be louder than our voices need to be loud, and our actions should be louder. So can we just take a moment and make a pledge that we are going to support this and take something back from it. Thank you to all of our panelists, to our lovely participants. Have a great day.